Okay. We're going to be talking today about video guided endotracheal intubation. The first thing you want to do is assemble all of your equipments.
Okay.
And here we have the respiratory therapist showing us the equipments, and James, tell us what you have in your hands.
We're going to start off with an 8 tube. We have an 8.0. This is the rigid stylet that you have to use with the glide scope. We have an 8.0 tube, which I just said, with the syringe. We have a little KY in case we need it. This is the tube secure right here.
Okay.
And then we have something called the stat, the glide scope stat. And we're starting off with a number 3. This is a 4, and we have the 4R3.
Okay.
All right.
So now he's going to tell us about pre-intubation of the patient. We normally want to give the patient some oxygen to make sure, and you can demonstrate that first.
Okay. We'll give oxygen to the patient with a bag.
Okay. And for this, we use a non-breather, and the flow rate is set extremely high to fill up the bag.
This is a non-breather right here. We have over here. It's a non-breather mask, and this is the resuscitator bag.
Okay.
We usually go from the non-breather to the resuscitator bag. And then we'll give a few breaths. We'll connect this to oxygen source, and we'll put it on the face, and we'll give them a few breaths right here.
And while you're doing this, you're looking at the reading of the saturation on your monitor to make sure it's 100%.
Which will be on this monitor right here. We try to get to 100%, or the closest we can get to 100 before we intubate.
Okay, excellent.
Right. Then we will turn on the machine, the glide scope machine. The whole time we'll still be bagging. And once you turn it on, then you take this part right here. This is the connecting. And we're gonna take it and we're gonna put it into the stack. And you snap it in. We go snap that on in. All right, and it's in there. Not gonna come out. You'll take this part right here. You'll put it in the patient's mouth on top, and then you can see this goes to the stomach, and this is going to the lungs. All right.
And now looking at the lungs, looking at the trachea, you can see the white markings of the vocal cords. You want to go in between that with your tube.
Yes. Okay. You'll take the rigid stylet, you'll have that ready already, and it's gonna go in here. And it makes like a curve like. That's why we try to use this stylet with the glide scope. That's what comes with it, and that's what's recommended. All right? No air in your cuff. You take your tube, slide it right side the stylet, and in. So if it's going in and you see it's going to the stomach, we want to raise it up a little bit. So Mr. Will, if you pull up a little bit, there you go. Pull up a little bit, Mr. Will. There you go. All right. Okay, I got it. You can let go, Mr. Will. And it's going straight into the trachea. What happens is, once it gets right here, and it's going to be down, then you pull up on this. And then that brings it straight to the trachea.
Okay, excellent.
And it's in.
All right, so now the tube is in. The next thing you want to do is secure the tube in place.
Hey, Will, you can hold that? You can put it right there. All right, so then what you'll do is you'll add air to your cuff. And we'll use this tube secure right here. This is the one we use because we transport our vent patients. So we use this one because it's good for the ride on Acadian. It won't come loose. This is called Ambu tube holder.
And at this time, you would have already checked the breath sounds.
Yes.
With your.
Yes, I'm gonna show you that dot. But I'm gonna secure this. Well, we should the Ambu bag, the bag. Before I do this, we got to make sure that it's in. We'll use a CO2 detector, which I don't have on here. And I'm gonna show you that. And you can see the lungs are inflating. It's in. Well, in that cabinet right there, you're gonna see some little box to your left, CO2 detectors. They're dope. You can see it's in. It's bad. Now before that, to make sure, yeah, I can open. I got a lot on. we use this CO2 detector right after you intubate, and this is going to turn yellow. So that's how you know this CO2 is detected, and we know we in. And then we verify with breath sounds and an X-ray.
Exactly. Again, there are three ways. There are three ways to confirm your position of the tube. The first and most reliable is the wave capnography, which we do not have at this point. You do the breath sounds, and you also do a chest X-ray.
Yes.
When you look at the chest X-ray, you want to make sure that the tip of the endotracheal tube is about 2 centimeters above the carina. And finally, after securing your tube, your patient is ready to go. And this ends this video demonstration of endotracheal intubation from PREVOST Hospital in Donaldsonville, Louisiana. Thank you.